How did we deliver a positive pregnancy result to a patient who had been longing for a child for 19 years? IVF treatments can sometimes be discouraging and exhausting. Especially patients who do not get results from their first treatments can experience very serious psychological difficulties. The most important thing for these patients is to continue with the treatment. The patient for whom we saw a heartbeat yesterday and delivered a positive result was one of them. This patient, who has been seeking a child through IVF treatments for years, since around 2010, starting from the second or third year of her marriage, had undergone 5 embryo transfers but had never seen a positive pregnancy result. As a result, the patient experienced significant psychological distress. She began to lose faith in the treatments. When she came to our clinic for the first time afterward, we could clearly observe this exhaustion and lack of faith in her. After that, we started the treatment. In our first treatment, we managed to create 4 embryos, and we found 1 embryo to be genetically healthy. We scheduled a day for the transfer, but due to these difficulties and psychological distress, our patient did not come for about 1.5 to 2 years. This patient, whose embryo was ready and for whom the transfer was actually very simple, avoided even transferring the ready embryo due to her own inner struggles and personal life issues. Later, when our patient came, we transferred this embryo and gave her the good news of a positive pregnancy. Afterwards, we also saw the heartbeat. In other words, we achieved a clinical pregnancy. If the patient had quit treatment early, if she had never tried these treatments out of hopelessness, her age would eventually have passed and she would never have had a child. The important thing in IVF treatments is to keep trying in good clinics and good laboratories, even if you get negative results. Achieving results with difficult patients is very rewarding, and we love working with challenging cases.